My name is Andrea Batten, and I am with Gallagher. We work with Onestaff Medical on how to develop your benefits and offerings, and go through with you today what is changing for 2020. So we took a look at possible, and we're able to make some good changes, some improvements to benefits, as well as some cost savings. So we'll go through all of that today. In addition, we're introducing pet insurance, which I think a lot of people are excited about. And on the medical piece, changing administrators, what it means to you, the most important part is you're going to be receiving new ID cards, and they come in very generic white envelopes. So watch for those and don't throw them away. I tend to throw mine away every time I get a new card. So that's important to remember. The other thing is you won't have a national network. And I know as traveling nurses, we've had issues in the past where providers did not recognize Health Scope, which is really the name of your administrator on your card. It was not a network. Moving a national network like United Healthcare will eliminate any of those issues that we've had in the past as well. So first, your dental plan. These are the same core benefits as you have currently, but are moving to Emeritus. One thing out there at the bottom of the slide, you have this benefit currently, but I want to make sure everyone's aware. As long as you get your teeth cleaned at least once a year and you don't go over a certain amount of spend, your calendar maximum will grow every year. So for example, in that plan one, the calendar year maximum is $1,000 per person. If for years you go get your cleanings but you don't use any other benefits, that your maximum will grow, so that maybe in years when you need a crown or something that's going to cost much more than $1,000, you have $1,500 in your calendar year max. So all of the details of the plans are available online in your online enrollment packet, but just high level, just wanted to remind you of that benefit. Vision, moving to Emeritus as well, same thing, the same basic coverage, but now you're going to have a choice of network. So when you go in to enroll, what your choice is going to be, you're either going to enroll in the VSP network or the IMED network. Really, friends, you currently have VSP. VSP really historically has focused on ophthalmologists and some private offices, where IMED has really focused on some of the big box stores, Pearl Vision, Walmart, Shopco, those types of things. So it's really just about your preference. The IMED network has a little bit better benefit on contact lenses. Once that $130 is used, then you get an additional 15% discount. But in essence, what you're choosing when you enroll in Vision is what network you'd like to go with. Life Reminder, that provides you with a flat $10,000 life insurance benefit. If you are in need of additional life insurance coverage, this is a true open enrollment for life. So normally you have an opportunity as a new hire to enroll in additional life insurance. If you don't do it at that time and you try it later, many times the carrier wants to know why. So you can, if you didn't enroll initially, you can enroll now. You can purchase coverage in $10,000 increments to a maximum of $500,000 or 7 times your salary. But what's guaranteed to get without having to answer questions is that $150,000. Okay. You also elect coverage for your spouse. Just remember, it can't be more than 50% of what you elect. So if you have $100,000, you can't elect more than $50,000 for your spouse. And there is a benefit for children as well. After the first year, we'll get some more information out, is a program through LifeWorks. It's a work-life benefit, and it has some really neat tools and resources for everyone to use, and be sending more information out about that after open enrollment. So just take a minute to stress the importance of disability benefits. In my opinion, it is the most important coverage to have next to medical. This is insurance on your paycheck. So basically what happens is if you're unable to work due to injury or illness, if you look at the shortened disability to start, elimination period of 14 days, what that means is the first 14 days that you're unable to work, you need to use vacation or sick time, any of the paid time off that you may have accrued. After that, this plan will reimburse you 60% of what you were making prior to being unable to work, to $1,000 per week. Total 11 weeks. If still unable to return to work and you've elected long-term disability, these two dovetail and run, one runs into the other. Long-term disability, you'll receive 60% of your salary prior to becoming disabled to $5,000 per month. So to consider if you've not thought about it before. Illness coverage, we are changing carriers on this to MetLife. This is really a cash benefit. So you elect either $15,000 benefit or $30,000 benefit. And on diagnosis of cancer, for example, you receive a check for $15,000 or $30,000. This is not an insurance plan. This is a benefit plan to help with any expense you need help with. So many times when there's a major diagnosis, critical illness that's diagnosed, there are lots of other expenses that go along with it, in addition to a deductible and an out-of-pocket or healthcare related expenses. The key to critical illness, you have to file the claims. So in a traditional insurance environment, the providers that we see file those claims for us. Since this is insurance, that's not the case. So you see there in the middle that it says additional option, a health screening benefit. There's it on this plan that if you get your annual exam once a year, you get a $50 benefit, a $50 check just for doing that, which sounds great. It may pay for the majority of your premium, but if you don't file the claim yourself, you won't get that reimbursement. So the key to making use of these benefits is remembering to file the claim. Next, this can be really lucrative and beneficial, especially if you have small children who are getting hurt all the time. It's a double, quadruple dip type plan. So let's just use an example. Let's say that you fractured your foot. So you can see an injury's fracture. So you're going to receive a cash benefit for having an injury that's a fracture. Now the amount of that benefit is specific to the body, right? So some are worth more than others apparently. So you're going to file a claim for the fracture. Let's say when it was fractured, you went to the emergency room. You get a benefit there in the middle for emergency care, and then you had to go to your physician, obviously, to follow up. That's a third cash benefit for the physician follow-up. A key to receiving these benefits is actually filing those claims. Okay. So we've had lots of people asking for pet insurance, so we're offering it this year. It's available for traditional domestic pets, dogs, cats. It's also available for birds and other more exotic pets. So if you're interested in pet insurance and you're enrolling a traditional domestic pet, a dog or a cat, you can go to petnationwide.com/onestaffmedical and enroll online, or you call number there on the slide. If you are interested in coverage for a bird or exotic pets, you have to call. That is because they have questions and the specifics about the species and the breed would dictate your premiums. So one note, if you do enroll online, make sure that you choose the payroll deduction option. Otherwise, they'll bill you directly and it won't come out of your paycheck. So that covers everything there. So we're going to talk about your medical plan and just making sure that you understand how it works. So the first term to talk about is copays. Hopefully everyone's familiar with what a copay is, but it's a per visit amount that you have to pay before receiving services. So on the high deductible health plan, there are no copayments for office visit type visits. They're on the PPO plan. You have $30 copay for primary care. So what that means is before your doctor will see you, you have to pay $30, right? Check in. $50 for a specialist, $15 for health, which we'll talk more about, and $100 for urgent care. So a copay is a per visit amount that you have to pay prior to receiving those services. Visit type copays, you have prescription drug copays as well. It's a little confusing on the high deductible health plan. I'm not exactly sure why carriers do this. But if the deductible is met on the high deductible health plan, pharmacy copays will kick in. And what it means in practice is you could be paying, let's say, $75 a month for the 6 months of the year. You meet your deductible, and then it goes to $10, which may seem a little confusing at the time. So if that happens, just call and they can remind you of that. And then on the PO plan, obviously it's $10, $30, or $100, depending on the medication that you receive. So when you need other services that aren't available in a doctor's office setting, they're subject to deductible. And what that means is the deductible is the amount that you have to pay before the insurance plan begins to pay. So here on the high deductible health plan, it's $3,500 deductible for an individual, and on the PPO plan, it's a $1,500 deductible for an individual. So if you look at PPO plan, you will pay $1,500 pocket first before the plan begins to pay. So insurance happens once the deductible is met. So once that deductible is met, you share in the cost after that with the insurance plan. So if you're on the high deductible health plan, once your deductible is met, you're responsible for 20% of services after that. And on PPO plan, you're responsible for 30% of it after your deductible is met. But really important slide when it comes to understanding your health plan. This out-of-pocket maximum is really illustrating your worst case scenario, okay? So if you, God forbid, are in an automobile accident and you're hospitalized for 3 weeks, right, those bills can be upwards of $600,000. If you're deductible health plan, you know that you won't pay more than $6,000 in a year, and that amount includes deductible and any copays that you have made. And then that amount is $6,600. So this is something to consider when you're looking at which plan works best for you. This is kind of your risk that you would be subject to in a really bad year. Here's a side-by-side comparison of the benefits. I warn you that beginning in 2020, if you are on the high deductible health plan, you will have pre-tax money deducted from your check to fund a health savings account. So many of you, the nurses weren't able to join when we talked about health savings accounts, but this is really more lucrative than even a 401k is. 401k contributions, it's more tax deferral. You don't pay taxes when the money goes in, but when you retire and you begin to withdraw that money, you are taxed on it. And you're taxed at a time when you're making less than you're making now as an active employee. Savings account, money goes in pre-tax. You can earn interest on that money tax-free. And when you take it out, as long as it's used for healthcare expenses, you don't pay taxes on it either. So it is the only savings vehicle where money remains tax-free. For information about that, please reach out to Human Resources, but it's a wonderful benefit. Okay, so examples now of how do you choose? What should you consider when you're trying to decide what plan that's best for you? So this is Christina. She's young, healthy. She rarely visits the doctor, but always has her annual physical. So you can see that for annual physical, she pays nothing regardless of the plan she's on. So no matter what you choose, routine annual physicals and well-being exams are paid at 100%. She's going to take prescriptions in the year, and I made some assumptions about cost. So for that high deductible health plan, you don't have copays, right? So what does that mean on pharmacy? So what that means is you're going to pay the full cost of the medication. So currently, if you are paying, let's say, $10 a month for a prescription, you really don't know if you're paying $10 of a prescription that costs $11 or if it's $10 of a prescription that costs $250. It becomes critical if you're considering moving to the high deductible health plan. So health plan, if that medication were $250, you would pay $250 at the pharmacy in order to pick up your medication, okay? So made some assumptions on her medications on the high deductible health plan. We're going to assume that annually those 3 prescriptions will cost her $320, okay? On the people side, when we're looking at those co-payments, they're going to cost her only $120. She has 2 sick visits, so I assumed $150 a piece. For that's $3 on the high deductible health plan. Those same visits on the PPO plan, there are co-pays for those, so it's $60, $30 co-pay each time. The premiums. So you really take into account the premiums that you're paying. So on the high deductible health plan, Christine's paying $1,000, just over $1,000 annually for that coverage. But on the plan, she's paying more than $4,000 for that coverage. So we need to take into consideration that premium, her total costs for the year under the high deductible health plan are $1,700, and the PO plan is $4,500. So obviously, the health plan in total at the end of the year is better for Christina. Now, that being said, the total cost line is a great gauge for you. You also have to consider your in your particular situation. Excuse me. So when I was younger and a single mom and money was tight, I paid more in premium every month, knowing that I could at the year have saved money because it's easier for me than coming up with maybe $150 for an office visit that was not expected. So while total costs tell a very clear story, the decision has to be what's best for you. You have to make sure if you have prescription drugs that you're going to be able to have the cash flow to pick up if you're on the high deductible health plan. Okay, the next is Dorothy, and Dorothy has a family, and so this is a much different situation. So they've got a lot going on here. She gets 2 prescriptions a month, and she goes to a physical therapist twice a week, and takes her kids to the doctor every couple of months, and sometimes has prescriptions. Her husband's pretty easy. He's not causing them much of a headache. Again, the annual physicals, there's no cost to the family. The 20 prescriptions that Dorothy gets on the high health plan, I assumed $1,140. On the P plan, it would only be $480. The 10, let's look at the difference there. So a sick visit, again, about $150. So I have $1,200 that would cost under the high deductible health plan a year. Whereas plan, because there are co-pays, is $300. Her physical benefits, a high deductible health plan would be a cost of $900, $360 then on the PPO plan. Now we get premiums of a differential in the premiums when you're talking about family coverage. So to total cost on the high deductible health plan, the total cost is $16,400, and on the PO it's just over $17,000. So this is much more even total cost, right? So it may be a no-brainer for Dorothy to stick with the PPO plan since those costs are just much more in line, okay? All right, then third example. So this is Chris, and Chris is relatively healthy. He gets 3 prescriptions every month, but he's going to have knee surgery, and that is $10,000. He knows that's happening in June. Basically, I just put for the prescriptions and the office visits, because what we do know is Chris is going to meet his out-of-pocket for the year. Remember on that earlier slide I said that's really the gauge. So when we look at the high deductible health plan, his out-of-pocket is $1,000. The premiums that he's going to pay on the high deductible health plan and his total cost for the year is just over $7,000. On the plan, his out-of-pocket maximum is $6,600. You look at the paying, and it is a $10,000, almost $11,000 total cost. Okay, so that's obvious that the high deductible health plan, even with a major surgery, is the best choice for Chris in total. Here's the catch. Until he gets the surgery in June, he has to have enough money to pay in full the prescriptions and the office visits and anything else that comes up. So again, the same word option, the total cost may look very obvious as to what best choice is for you, but again, take into consideration on that deductible health plan, how are you going to pay for those prescriptions? Since there's no copayment, you're paying the total cost. So the most important thing when considering the high deductible health plan is figure out what your prescriptions really cost. There's an app called GoodRx that is a guide for that as well. I'm going to focus a little bit on how can you save money. So I want to impress upon everyone that you have responsibility to help save yourself money, but also to help save the plan money. Okay, so if premiums go up every year on medical, it is an indirect relation to how the population for Onestaff is using the plan. So we're going to talk a little bit about how you can help keep costs down, not only for you, but for the plan itself. You really do have more control than you think. So the first bullet, over 60% of healthcare expenses are related to our lifestyles, is completely true. And the best example I have is, in the world, probably the biggest classification of medication, okay, drugs that has the most meds in them, is for heartburn and acid reflux. So if heartburn, when you eat a burrito at 11 o'clock at night, perhaps you shouldn't eat the burrito at 11 o'clock at night, but we don't want to do that. We want a pill, okay? So preach to the choir, I'm sure, but first of all, to help mitigate and keep costs down is paying attention to our lifestyle. In addition to that, though, ask questions and do your research. So make sure you understand if a physician has a treatment plan for you, that you understand why. Ask why. I put things in here. All PPO providers are not created equal. What I mean by that, and you all be very, well-versed in this as nurses, being a participating provider only is that you've agreed to take a discount on what you bill, right? So if you have Dr. Smith and Dr. Jones, Dr. Smith may charge $800 for something Dr. Jones charges $300 for. So they're both, quote, in the network and participating providers. What they charge can be drastically different. Obviously, you're going to research that on every office visit, but if you're getting something like a knee arthroscopy or something like that, it really is in your best interest to check the doc that you're considering to see who has the most reasonable cost. Pharmacy, well, if you fill prescriptions at Walgreens, don't. It is the most expensive place in general to fill a prescription. I'm guilty of it myself because I want to drive through. I'm trying in 2020 to commit to not going to Walgreens. If you didn't know, depending on where you are, you can fill prescriptions at Costco without being a member. They have great pricing, very aggressive pricing. But again, that GoodRx application will put you in the direction for less expensive medications. When it's not an emergency, please don't use hospital for MRI, CAT scan, colonoscopy, any of those things. So it is much more expensive than a standalone facility. So not only will it cost you more, but it's going to cost the plan more, which in turn increases the next year when relating to premiums. So here's the thing. You get an MRI at a hospital, it can be $3,800. You get an MRI at a standalone facility, it could be $750. That difference is ridiculous. And we need everyone to be aware of those things and make the better choice, which is the less expensive option, okay? Just some things to think about. Place is also really important. So start on the right-hand side with emergency room. One of my biggest pet peeves in this industry is when I see reports come back where people have gone to emergency room for bronchitis or ear infections, those types of things. Emergency rooms are meant for life-threatening situations. They are incredibly expensive compared to the other places that seek service. And it's just an appropriate place for primary type treatment. I think some people get in the habit of doing that because, you know, even 5 years ago, I don't think we had as many physicians' offices staying open as late, and people didn't want to take off work to care, so they ended up in the emergency room. It is very, very expensive to seek care in the emergency room. So please, if it's life-threatening, that's exactly where we want you to go. But let's say you're playing basketball and you sprain your knee. It may hurt really badly, but you're not going to die from it. Urgent care is probably the best place. They can do x-rays and things there as well to that if you need further tender to see an orthopedist. Okay, primary care obviously is even less expensive than that. And telemedicine is a great option. So we'll talk a little bit about that. It's basically FaceTiming a provider. It's for run-of-the-mill type conditions. So if you have something that we need a physical examination, like a sprain or a strain, obviously this isn't going to work. But I've done it when I thought I had strep and basically held the phone up, said off so we could see my throat, got a prescription. So I would highly recommend that you consider that. And if you look at the dollar amount there, if you are considering the high deductible health plan, if you telemedicine, it's going to cost you $45 as to a primary care visit, up to $70, $75. So it's another option to keep in mind. Okay. Basically, everyone's going to receive an email, and it's going to contain a link to go in and enroll for benefits for 2020. Benefits and enrollment is open through November 26th. And please don't wait till the 26th to enroll. The closer we cut to the 26th, the more likely run the risk that we may not have ID cards by the 1st. So please watch the email and follow the link to get enrolled. Thank you. I appreciate it.